Hello students, welcome to the class. I am Yogitha. Subject is Psychiatric Nursing. Today's concept is thought stopping technique. Students will learn many times like whenever the individual interrupted with their thoughts, like repeated same thoughts are coming, some negative thoughts, even in behavioral training or assertive training techniques, we told them to train with them thought stoppage technique. Now let us discuss in detail what is that. Now, this thought stoppage technique, it is uh, developed by Joseph Volpe in the year 1990. So he developed the pattern which will help us to have control over our unwanted thoughts. Now, what you have to do here? Here, you ask the patient to sit in a comfortable position, whichever the position is comfortable for them, and ask them to close their eyes. So once they close their eyes, when they are completely comfortable, automatically the thought will come to their mind. They have to concentrate on a one thought which is unpleasant that will come to their mind. And in mind, when this thought is completely present, after complete appearance of this unwanted thought, the patient has to say stop aloud. Like stop. See, when they immediately say stop, that will interrupt our thought process. So immediately that bring it into a one's awareness. Now after that, we should train the individual to shift your mind from that unwanted thought to pleasant thought. You have to think about the event which is really desirable, which you like most. Now, what happened? Interruption of that thought again happen. Again, the same unwanted thought may come. Again, you have to practice the same. Now, here with the long practice, it will help us like to take a more time. So, repeatedly when we practice this, repeatedly you ask them to close the eyes, sit in a comfortable position. The thought will come to their mind. Immediately, the patient has to say loudly, stop. That time it will come to their self once awareness. Then they have to shift their mind to the pleasant thought. Now repeatedly when they do, the interval between this unwanted thought recurrence will take a lengthy time. So time between like taking this thought again and again coming in mind, that takes a long time. Now what happened? It become a practice. So constantly when the individual practice that become a practice for individual to have control over this unwanted thought. Now the length of that timing, that repetition of that thought, it will be a more. So to come back to that unwanted thought, it will be a little more longer time. Now it's correct. If you are in a public place, how do you scream aloud stop? You cannot. So what happened when repeatedly you practice? When the patient is alone, we must encourage them to practice. Now repeatedly when they practice, when they are alone, this technique will be trained to them. So this technique will be trained. They get adapted to the method what they are practicing. So gradually in mind, even if you silently say stop, the mind will help you to stop with the unwanted thought. So in public place you no need to scream, but it will become a practice to you by repeatedly doing this thought stoppage process technique. So later gradually if you say in a silently in your mind, that will be more than enough for a patient to have control over their unwanted thought. So this is what thought stoppage technique. And this technique will help the individual to have control over the unwanted, unpleasant thoughts which will disturb their mind as well as disturb their life. So we need a lot of practice for that. This is for information how to use this, and when you use this, you require a lot of patience, lot of training, lot of practice to do this technique. I hope you understood. I request you, please keep watching, keep reading, and keep studying. That's all. So that I'll meet you in next video with a new concept. Until then, take care of yourself. Thank you all.